Let's discuss the effects of intubation and hyperventilation on two vasculature, pulmonary versus cerebral. Actually, it is a reverse. So, if you, hyperventilate and drop CO2, so it has opposite actions at both organs. Let's take the first lungs. If you drop CO2, it causes vasodilatation, pulmonary vascular resistance drops, pulmonary blood flow increase. As compared to the brain, if you drop CO2, it leads to vasoconstriction, decrease cerebral blood flow, and this is one of the treatment for increased ICP because it decreases the intracerebral pressure. And if you increase CO2 by hypoventilating someone, so lungs has effect in the form of increased pulmonary vascular resistance and decreased pulmonary blood flow because it vasoconstricts the pulmonary vasculature. And reverse is true for brain because if you increase CO2, it leads to vasodilatation in the brain, increase cerebral blood flow, and ultimately you have a high ICP. Why it is important? So both diseases, pulmonary hypertension and raised ICP, can be treated to some extent, especially in case of emergency by hyperventilating and dropping CO2 in these patients. Suppose if you in cardiac ICU and you have a patient with pulmonary hypertension because you know they have specific lesions like ventricoseptal defect, AV canal or truncus arteriosus. So these are the lesions who are at high risk of having pulmonary hypertension post-op. How they present? By increased heart rate and JVP, and their PO2 and saturation is on the lower side with blood pressure normal or on the low. And also they exhibit low cardiac output, mixed venous saturation is decreased, increased lactate and decreased urine output. So what is the treatment? By hyperoxygenation, milrinone, sedation and sometimes muscle relaxant and nitric oxide. And obviously hyperventilation is one of the cornerstone of treatment for pulmonary hypertension by dropping CO2. Let's take the brain now. If you have any patient with raised ICP in pediatric ICU because of traumatic brain injury or intracranial infections, so obviously you have to follow the clinical features suggestive of ICP like papillary edema or deteriorating level of conscious level by dropping GCS. They may exhibit high blood pressure, but low heart rate and irregular respiration is a late sign for raised ICP and we should not wait. So what is the treatment? You have to remove the cause which is increasing raised ICP. You can give mannitol or hypertonic saline. We prefer hypertonic saline 6 ml per kg over like 15 to 20 minutes, and you can repeat boluses because mannitol has a disadvantage of lot of time patient they pass a lot of urine. You have to maintain cerebral perfusion pressure sometime by increasing the mean arterial pressure, and obviously if you if you are struggling to maintain raised ICP or treat, so you can intubate and hyperventilate by dropping the CO2, especially like low 30s, and you can buy some time so that your other treatment of raised ICP can take action. So you see how interesting is this relation that if you intubate and hyperventilate someone, it has a reverse action, opposite effects on pulmonary and cerebral vasculature. So it leads to vasodilatation, decrease CO2, and in case of brain, it vasoconstrict. So that's very interesting, and it has so many application in pediatric ICU.